The reason that we raised it to the variant of concern level was really because we saw very many more mutations in this one than we've seen in any of the previous variants. And quite a few of those mutations were in the spike area of the virus, the bit it uses to get into our cells. And also, if that's the bit that we target with vaccines. So for all those reasons, that's the main reason we raised the world's awareness that to look out for this. But it's important to remember it's a variant of concern, not a variant of panic. And to date, we are seeing that it's certainly associated with a big rise in numbers of cases in South Africa. And the South Africans are also reporting that they're seeing infections with Omicron in people that have had previous versions of SARS-CoV-2. So there's some suggestion that natural immunity doesn't seem to be holding against this one. But we're still confident that the vaccines will be able to do their job.
We'll get into the vaccines in a moment, but we're expecting some more information on the transmissibility of Omicron soon. But what do we know at this stage about how transmissible this variant is?
Well, as I mentioned, we're looking at what's going on in South Africa to really understand a great deal more about what this variant will do. And again, one of the reasons we went straight to putting it on the variant of concern list was the South Africans had a very flat curve, virtually no cases, just 300 or so, and then it went up very quickly. It went straight up, their numbers. And that was coincided with the arrival of Omicron. Now, we still need to understand whether it's Omicron that's driving that. They've also got Delta, but this does suggest a greater transmissibility.
How effective are we seeing vaccines be against this new variant?
So that is work that's underway. We had a call with more than 400 scientists on Monday, and it was agreed to do all the work, the neutralization studies, to look at whether or not the antibodies generated by vaccine, so you get the antibodies from people's plasma and you put it with the virus itself and see if those antibodies can still neutralize the virus. We need to see what the outcome of those studies are, and we'd expect to see that fairly soon. But we also want to see what's happening in the real world. Are people ending up in hospital, and are those people ending up in hospital people who've been fully vaccinated, or are people who are fully vaccinated who are infected with this, are they having mild disease? So all those questions still really need to be answered.
The World Health Organization has been critical of countries for imposing border closures or border restrictions as a response to Omicron. When those border restrictions have helped in stopping the spread of COVID in the past, why is the WHO calling for those borders to remain open?
So we don't really like blanket bans, especially in this sort of circumstance when it's likely that Omicron had already come to the various countries. But we do understand that sometimes a country feels they need to put a short closure, a short ban in to give themselves time to get all their systems in place, to get their hospital systems ready, to get their surveillance ready. So we say, we don't like it, but if you do it, use your time very wisely. We prefer to see a more layered approach where you look at quarantine and testing before and after. But we do also say it is up to national governments to make the decisions based on their own epidemiology and their scientific assessment.
And when you say use your time wisely, what does that look like?
So that's things like, how's your tracking and tracing? Have you got testing in place? Is your population aware of what they need to be doing? Are you able to organise things so that people can socially distance? Maybe you need to be suggesting that people work more from home. Are you working on all your arrangements to improve ventilation? All those things together. And also, where's your vaccination program? Are you accelerating your vaccination program? So all those things need to be done together to have a really good response.
Do you expect that we will keep seeing this in the months and years to come, that we'll keep seeing these new variants emerge?
If we get the world vaccinated and get the world vaccinated in an orderly way, in other words, the highest risk groups, most vulnerable people vaccinated all around the world at the same time? No, that we will suppress the virus. Also, if we keep doing the public health social measures, the distancing, the mask wearing, all those other things, when we've got outbreaks raging to bring the cases down, the virus won't have anywhere to go. So no, it won't keep on changing if we keep on doing the work to stop it having the space to make these changes.
And what needs to be done to boost those global vaccination rates?
Sharing vaccines. So the vaccines have been very much concentrated in the resource-rich countries. The resource-rich countries bought up huge numbers of contracts and put in very big advanced orders, freeing up those orders, but also sharing the technology and putting pressure on the companies to waive intellectual property rights for the emergency, not forever, not at all, but for the emergency, so that the vaccines can be made when they're needed. But in the short term, we really just have to be a lot better at sharing the vaccine doses to make sure that through the system that we and partners set up, the COVAX system, that we can genuinely deliver them.